Do we like the light or do we like not the light? Let me have a look. Yes, I'm in pajamas. Shh. I don't want to hear it. Is the light better? I don't know if it just detracts from my face, but not that anyone actually wants to look at my face, so. Hi guys, welcome back to my channel. Long time no see. About 4 months to be exact, because that's how long I've been a doctor. Mind blown. But yeah, I thought that now that I'm coming to the end of my first rotation, we would take this opportunity to have a chat about what's been going on and how everything's been going. I'm gonna try and not ramble in this video, but it never really works out that way, so it might be a little bit long. I'm sorry, bear with me. If you don't want to hang around, then I honestly don't blame you. But let's get started. First things first, I thought I would go through what I've actually been doing in my job, because this is what is this? Anyway, this is the sort of thing that I would have been interested in, I think, as a medical student. If I've already gone through this, I know I made a video like 4 months ago. I have not the slightest clue what I said in that video. If I've been through this already, sorry. I graduated from medical school at Cambridge in June of this year, and I started working as a foundation year 1 doctor in August. So the way it works is you have 2 years of foundation training after you finish med school, and you rotate around 6 specialties. So you have 4 months per specialty. So the one that I started on was acute medicine. Bear in mind that things work very differently at different trusts and at different hospitals. So what I've experienced will not be the same as what other F1s have experienced at different hospitals. It just honestly depends where you are. But at my hospital, for all F1s in medicine, you basically have your normal working day shifts, which are your 9 to 5 shifts on the ward, and then you have your on-call shifts, which are 12.5-hour shifts, either on medical take, so clerking, or doing ward cover. We have all of the different variety of on-calls, so you have your normal weekday on-calls, weekend on-calls, night on-calls. Day to day, I work on AMU, which is the acute medical unit, and your normal day job, 9 to 5 job, is as you would expect any medical job really. You do your ward round in the morning, and then you action all the jobs from the ward round. So that's like booking scans, chasing bloods, taking bloods, doing investigations, sending off referrals, talking to other specialties, all of that kind of stuff, writing discharge letters. That's just sort of your normal day. AMU is basically where patients go a lot of the time when they get admitted from A&E. So most times they won't go directly to a specific specialty ward. They'll go through AMU first, which means that we actually have a lot of quite unwell patients and patients who haven't had a lot of investigating done yet. They've just come straight in from A&E. So there's a lot of management to be done. There's a lot of investigations to be organised and a lot of diagnosing to be done. And I think that's why it's quite a high stakes ward and it's quite a busy, high pressure ward. And that's why it's consultant led, which is one thing that very much differs, I think, from other wards, other medical wards especially. We have a consultant-led ward round every morning, so you go around with the consultant to see the patients, which is very nice as an F1, I think, when you're just starting out, because I know that on other wards, sometimes when it's really understaffed, you will potentially be doing the ward round by yourself. So clerking is basically seeing patients, for lack of a better explanation. Basically, when someone presents to A&E, they're first seen by the A&E team. So they assess them, and then if they decide that the patient has a medical problem, so for example, not a surgical problem or not like an obs and gynae problem, then they will refer them to the medics if they think that they need to be assessed further and potentially need admission to hospital. So then we are the medics who then basically assess the patient from scratch again. So we go through their entire past history, we look at the systems, we look at their past medical history, their drug history, we look at all the investigations that they've already had done. Then we go and see the patient. So we take history, we examine, we come up with a list of potential diagnoses that they might have, and we come up with a plan. So whether they need admitting, what sort of investigations they might need, what their treatment plan is, etc. And then they're also seen by a consultant after that who comes up with the final plan. So that's essentially the sort of thing that we do in A&E. And then ward cover is essentially you have a bleep and you get bleeped to come and do jobs. So it's either things like, you know, a patient who is deteriorating or a patient who's become a bit unwell, you know, when patients have had a fall or a medication needs prescribing or they've got high blood sugars, things like that, you will get bleeped and you have to come and deal with it. Weekends are a little bit different when you're ward cover because you get a list of jobs from the weekday doctors that need to be done over the weekend because obviously no one else is going to see these patients until Monday. So it's sort of just you. And then you also get all the jobs from the nurses. It's a bit crazy, it's a bit hectic. And at my hospital, as an F1, every medical on-call shift that you have, your bleep is a crash bleep. So that just means that if there's a medical emergency anywhere in the hospital, you will be bleeped and you have to go to it, obviously alongside the rest of the emergency team. So yeah, that is essentially what I've been doing for 4 months. Now that I've explained what I've been doing since I left medical school and became a doctor, it would be a good time to introduce you to the partner of today's video, which is Lecturio. So if you've been around for a while, first of all, thank you, honestly. Second of all, you would absolutely know all about Lecturio, but if you don't, Lecturio is a fabulous platform for medical students and honestly doctors as well. They have tons and tons of resources on there. They're all in one place, they're all super accessible and they're all really useful. I would genuinely highly recommend if you are in medical school or even if you've just become a new F1, because honestly, medical school, dissipated. Knowledge, gone. Was it even there in the first place? I don't know. No, that's a bit of an exaggeration, but I have definitely forgotten quite a lot. I thought I would talk you through some of my favourite bits on Lecturio. So first of all, they have an excellent question bank, which, like, you know, what revision session would be complete without a question bank? Just saying. But yeah, they have loads of different questions on there. They have really detailed explanations about, you know, why that answer is that answer. They also have video lectures on there which are just really well explained, really detailed. They have loads of useful diagrams. They're really easy to follow. I think especially if you're a medical student and you want to supplement your learning, there's loads of, you know, preclinical and clinical content on there, which is super useful. And my favourite thing, which I have banged on about repeatedly, are the concept pages. So these are basically like summary pages about loads of different conditions, and it's basically all the information that you could want about a condition just collated into this one nice little page of info. And it's so nice because you don't have to go scouring through like 5 different resources to find all of the information that you want. And yeah, they have loads of them, and I just think it's so useful, not only for medical students but also as an F1. I think, you know, sometimes you see conditions and you realize that actually, like, I've forgotten half of this. Whack open a concept page and consolidate, relearn, to be honest, revisit. If any of that sounds good to you, then I would highly recommend checking Lecturio out. I will leave the link in the description box. Also, from November 28th to December 6th, Lecturio are offering 30% off all of their subscription plans, which is an amazing deal. So if you are looking to check Lecturio out, I think that would be the perfect time to do it. Once again, link will be in the description box. Thank you so much to Lecturio for working with me on this video, and let's get back to yapping about how I've actually found my first 4 months as a doctor, because boy, it's been a journey. I think this is something that everybody says, but there have been some high highs and some low lows. But honestly, on the whole, I just find it still so insane that I'm actually a doctor. Like, I introduce myself to people as a doctor, and I'm actually a doctor, like, for real. But yeah, I went into this feeling quite apprehensive. I think when you're going into a profession that you know has a lot of issues and you know has a lot of problems that need solving and probably won't be solved. You know, when we were starting, there was still the potential of further strikes. And you know, when you're going into something where you've seen loads of doctors and none of them look particularly like happy to be there, sometimes it's just a bit like, oh, you know. But honestly, I've kind of loved it, which I didn't expect. I also don't know if it's just the fact that I find it so much better than medical school. Like, genuinely, if you are in medical school and you don't really love it and you don't know if this is even what you want to do anymore and you sort of are thinking about dropping out, trust me when I say it gets better. Like, I was in the exact same position and genuinely would not trade medical school for this. Would not trade this for medical school. That's what I meant. I just remember, you know, turning up on the wards as a medical student and sitting in a corner, people basically ignoring your entire existence sometimes, leaving and just feeling like you've achieved absolutely nothing and just being like, what is the point? And obviously that is no longer the case. You know, you turn up and you actually have a purpose. And I think maybe that was what I was missing. I just felt like I lacked purpose. I struggled with internal motivation, and not to say that I've gotten better at that. I still think that I rely on external motivation factors at the moment. But like, it's better because I actually like feel like I'm actually doing something useful. I think it's crazy what a long way I've come. I think looking back at what I was like when I started and what I'm like now, I think you don't realize it until you sort of sit down and really think about it, because I remember BNFing paracetamol. And like, I know the dose of paracetamol, but I remember being so terrified and feeling like I knew absolutely nothing and I was like the worst doctor in the world. And BNFing the simplest things and being so scared that I was going to make a mistake and feeling like I don't know what I'm doing and everyone's better than me, blah, blah, blah. I had such imposter syndrome when I first started, and I don't think that's completely gone away. I will say, like, the other day I got my feedback from this portfolio thing that we have to do where we get feedback from different team members, and it got released to me and I cried. Which sounds crazy, but like, some people had really nice things to say. And I do still think that I really struggle with self-confidence in the workplace and feeling like I'm actually doing a good job and I'm a valued member of the team sometimes. But I do think that I've come a long way. You realize that you're capable of so much. You know, I've been telling patients their diagnoses and explaining them to them. I've been having conversations with their relatives and answering their questions. I've obviously been making provisional diagnoses for patients, putting together plans of action, speaking to loads of different specialties, trying to get stuff sorted. And I don't know, I think little old me when I first came in just thought that I'd never get to this stage. And also at the end of the day, it's just so nice to sometimes feel like you've actually made a difference to someone. And I think everyone says this, but when a patient says thank you to you and like you can tell that they actually like truly mean it, it's just such a nice feeling, and you actually feel like you've done something good, like you've actually like been useful. So yeah, safe to say I've had quite a nice time. I'm not gonna lie, I do feel like I look at things with rose tinted glasses. I've noticed. I think, you know, I've gone through some horrific shifts and then looked back and been like, oh, they weren't that bad. And in the moment I remember like wanting to cry. So I think I just forget all the trauma parts and I'm like, I had a great time. But I will say, like, it obviously hasn't been without its struggles and challenges. I have had some horrible experiences. I have witnessed some things that I would rather not have witnessed. I, was involved in my first ever cardiac arrest. I've been involved in multiple cardiac arrests actually, which have honestly not been very nice, obviously, for obvious reasons. And I think it has been very difficult sometimes, and it's been very sad sometimes, and it's been very stressful, and I have been at the end of my tether a few times, but it's ups and downs, isn't it, really? I would say I can't complain, but I actually do complain. Quite a lot, actually. The on-call shifts, shockingly, I know, have actually been my favourite shifts, I think. The clerking on-call shifts. Not the 12.5 hour aspect of them, because I will say that by the 4th day in a row of 12.5 hour shifts, like, I am just, my brain, no worky. I feel like they're the most like doctory shifts that we do. Because the problem with the wards is that I sometimes just feel like you're basically just an admin person, which I know is pretty much a rite of passage at this point in the NHS. Like, someone has to do it and it's going to be you because you're the most junior. But I just know there have been some days where I've done the ward run with the consultant in the morning and I have genuinely not spoken to a single patient for the rest of the day. Like, actually, to be honest, I don't really speak to patients during ward run because it's the consultant. So there are days where I have literally not said 2 words to a patient because I spend the rest of the day on the computer, like, doing all the jobs and sorting everything out for them. And I don't have any reason to go back to see them. And I don't actually have time to go back to see them because I have no time. When we actually get to do our own assessments of patients in A&E, you get to learn so much. You get to see so many different patients and presentations. And then AMU, I'm so sad. I rotate out next week and I'm honestly so sad already. This is the sad and annoying thing about having to move every 4 months, is that, finally, when you've gotten to grips with your job, when you've gotten to know all the team and you feel really comfortable working there, you just have to move on and you have to do the whole thing again with like getting to know everyone, figuring out what you're actually doing, etc., etc. And honestly, the team on AMU is so nice. I have met so many lovely people. I will say there have definitely been downsides to AMU. I can probably count on 2 hands, potentially 1, how many times I have left on time from work. It's 95% of the time I'm so late. And it's just so busy. It's so busy. I am moving on to surgery next. I'm doing trauma and orthopedics for 4 months, which is going to be very, very different. Anyway, I'm going to stop talking now. I apologise in advance for the length of this video. It's not really in advance now, is it? It's the end of the video. But yeah, thank you so much for watching if you're still actually here. If you enjoyed it, do give it a thumbs up. You can subscribe to my channel for more doctor content. Hopefully next rotation I will have more time. And yeah, I will see you all in my next video. Bye!